Welcome to Faith and Freedom. For the next few minutes, we hope to inform, inspire, and encourage you as we discuss the legal victories and challenges to your fundamental freedoms and religious liberties. Faith and Freedom comes to you from Liberty Counsel, a civil liberties education and legal defense organization. Join us now as Matt Staver, the President and General Counsel of Liberty Counsel, explains the latest legal issues all across this country in the courtrooms of America. Liberty Counsel is winning the battle for your constitutional freedoms.
More than 1,000 companies have been granted an exemption from the ObamaCare legislation. I am Matt Staver, founder and chairman of Liberty Counsel and dean of Liberty University School of Law. Joining me is Matt Barber, vice president of Liberty Counsel Action and associate dean of the law school. Matt, Liberty Counsel has a lawsuit, as we have mentioned before on this program, against Obamacare. I will argue that at the Federal Court of Appeals during the week of May 10. But in addition to what is happening in the courts, there have been now over 1,000 companies that have received exemptions from complying with the Obamacare legislation. So there's becoming a pattern. These companies cannot comply with Obamacare because of the cost and the problems that it causes, and so they've asked for exemptions. And the Secretary of HHS, Health and Human Services, has simply granted in her discretion these exemptions to these organizations and companies.
Yeah, and we need to point out here, too, that we were saying companies, it's more than just companies. Unions,
right.
It's kind of an Obamacare handout. Those payback, if you will, those who have lined up in advance of the passage of Obamacare to support it and to help President Obama, Nancy Pelosi, and Harry Reid ram this very unpopular, massive government takeover of our medical system through against the will of the people. They are now lining up for their payback, and that's what we see happening here. The Department of Health and Human Services has disclosed 126 new waivers recently, bringing the current total to 1,040 organizations that have been granted a one-year exemption from this coverage. But Matt, the problem is that we have states lining up saying, we need an exemption. Our entire state needs an exemption because we cannot maintain fiscal solvency. We cannot and adhere to the dictates of Obamacare, the federal mandates that are imposed on this. We simply cannot keep afloat. Obamacare will literally sink us. So, I think they're moving in the right direction by granting these waivers. Unfortunately, we're only at 1,000. We need to just go ahead and grant a sweeping waiver and exempt everybody from this absolute disaster.
Well, right now, about 2.6 million people are covered by these 1,040 waivers that have been granted. 126 brand new waivers have been recently posted on the Department of Health and Human Services website, and so that number continues to grow. This is a trend where these companies, organizations, and unions are saying that they can't comply with Obamacare, that it just is too costly for them to comply. And for them to comply right now, they would have to literally eliminate their insurance coverage. And in response, the Department of HHS Secretary Kathleen Sebelius has just granted at her discretion these exemptions. And, the reason why she's granting these is that if she didn't grant them, we'd have these unions and other legitimate businesses that simply could not exist. And you would have even more of a public outcry when you have 2.6 million people losing their insurance because of Obamacare, and companies that simply couldn't afford it may actually go out of business.
Last time I looked, there were, I think, 26 states that have joined in. There may be more now that have joined in on the lawsuits against Obamacare. More states than not opposed this federal government takeover of our healthcare system. The Hill reports, quote, in order to avoid disruption in the insurance market, the healthcare overhaul gives HHS the power to grant waivers to firms that cannot meet new annual coverage limits in 2011. Well, the Obamacare gives the Department of Health and Human Services and Kathleen Sebelius a whole lot of power to do a whole lot of things unilaterally. It is up to her discretion who has to adhere to the dictates of Obamacare and who is exempted. That is not a constitutional republic form of government. That's a dictatorship. That's ruled by unilateral fiat.
Well, they granted 500 waivers in December. They granted about 200 waivers in January 2011, 126 in February. They're granting waivers every single month. So this is now 1,040. It's continuing to grow. The problem is that Obamacare is a sinking ship. It's a sinking ship politically. It's a sinking ship among businesses. It's a sinking ship within the court system. And so people are bailing out. And that's why you see these waivers happening. And I think one way or another, Obamacare is going down. I think that at the end of the day, it'll go down in the courts. Like I said, I argue our case, Liberty University versus in Virginia. From there, it goes up to the U.S. Supreme Court. Whichever person loses will ask the court for review. The Attorney General, Ken Cuccinelli, will argue the Commonwealth of Virginia case the same day as well. Those are the two cases to go forward. A month or so later, the case will be argued up in the Sixth Circuit Court of Appeals in Michigan. Out of a case in Michigan, it'll be argued probably in the Ohio branch of the Sixth Circuit. And then later on, there will be a case argued at the 11th Circuit Court of Appeals in Georgia, the one that was filed in Florida. So these are the cases that are moving in the direction, but our case really leads the pack. Whether it gets torpedoed first in the courts or whether this Congress defunds it, which they in fact have made moves to defund Obamacare, either way, Obamacare, I think, is going down.
It's going to, and it's inherently flawed. And as these waivers indicate, there are those who are applying for exemptions for waivers that are being granted waivers. Based on the whims of the Department of Health and Human Services. There are those who are being denied. Liberty University, our plaintiff in the lawsuit against Obamacare, we haven't been granted a waiver. There are a number of organizations that are asking for waivers and that are not being granted. So this piece of legislation is inherently flawed in that it is inherently discriminatory.
Well, and there's no real guidelines for the granting of the waiver. It's just the pure discretion of the Secretary of the Department of Health and Human Services, Kathleen Sebelius, who works under the direction of President Barack Obama. And it's no wonder why these big unions have been granted waivers, because they are the big supporter of President Obama, and he is paying them a political payback favor, no doubt.
No, there's no doubt that that's what it is, Matt. And, even the numbers that are now coming out as the dust settles on this and all the smoke and mirrors that they use to try to get certain numbers to say one thing, the CBO, the Congressional Budget Office, and objective finders of fact are looking at this, and we're hearing words like unsustainable, that this Obamacare is literally unsustainable. Well, if you think of a suspension bridge across a huge gulch or a gully, if somebody said, hey, you want to walk across that bridge? Now, keep in mind, it is unsustainable. I'm not going to walk across a bridge that's unsustainable. You fall to your death. Well, this piece of legislation is unsustainable, and if it continues in its current form and it is not shut down or repealed, then we can look forward to falling to our economic death, if you will, as a nation.
And, unless anybody says, well, Obamacare is designed to have universal or near universal coverage. Well, think about this. It is much easier to pay the penalty than it is for an individual to have insurance. And the penalty doesn't go towards offsetting other people's uninsured coverage or medical expenses. It's cheaper for an employer in many respects to pay the penalty as opposed to actually covering the employees. And if this were implemented, that's what would happen. People would pay the penalty and employers would pay the penalty, and it doesn't give any more coverage at all. I mean, so the ultimate rhetoric that people are going to have more coverage is wrong. What this does is explode the Medicaid rolls, and 3/4 of those people right now who use the emergency room at least 4 or more times a year for non-ER treatment are Medicaid patients. In fact, when I was going to the ER the other day when my wife was in a car accident, I was behind a lady who went to the ER for a cold because she had a sniffling nose. I mean, and this is going to increase and bloat Medicaid. that is a failed system, and this clearly is a failed system.
Well, of course, people are going to pay the penalty and not pay for the insurance. And then with the pre-existing conditions clause, if you're diagnosed with cancer, all you then do is then get your insurance.
I mean,
you pay the penalty. Of course, people are going to do that. It cannot possibly work.
No, it can't work. It has a broader implication in terms of having the government micromanage our individual decisions, and that's really what's behind Obamacare. Give us a call at Liberty Counsel. 1-800-671-1776. Visit our website at lc.org. You can support Liberty Counsel in this ministry through your prayers and through your financial support. This litigation on this case and many others is very expensive. We do it at no cost, but we need your prayers and obviously your financial support to continue to fight and advance these liberties. You can make an online credit card contribution right there at the Liberty Counsel website, lc.org. That's lc.org.
You have been listening to Matt Staver of Liberty Counsel. Our hope is to encourage and inspire you to stand up for your faith, family, and freedoms. We can accomplish a lot when we work together. Get informed and get involved today. Sign up for our free monthly newsletter, The Liberator. We will send it out to you free of charge. Stay informed with our Liberty Alert email update. Just click on the website at www.lc.org or call us at 1-800-671-1776. Tune in next time to learn more about your rights right here on Faith and Freedom.